So I work in stroke research, and I figured that I can use stroke as my topic today and just discuss more about the awareness of stroke and try to get more details out there. When you talk about epidemiology of stroke, it's the fifth leading cause of death in the US. It happens at every 40 seconds, and someone dies of it every 4 minutes. Has about more than 795,000 cases per year. It's the leading cause of serious disability in the US, leading cause of transfer to long-term care, such as nursing home or rehab. Economic impact of this disease is more than 34 billion, and that was just in 2000. So at this point, right now, it's probably much higher. Risk of stroke doubles with each decade of life, which is a factor that we don't really realize, but each time when we think about the growing population that we are all scared of that's coming in, this is stroke is going to be a higher, if not the same, it's going to be a higher leading cause of death, not in the U.S. but also worldwide. Blacks are twice more likely than whites to have stroke and have the highest rate of death due to stroke. And that the way it works is blacks are at a healthcare disparity, and we've learned in public health the factors that have led to for the minorities to have less access to healthcare, and hence that's my reasoning towards that the factor is this is the cause why it's the highest rate of death due to stroke. So what is a stroke? It's a brain injury caused when a blood vessel to the brain becomes blocked or burst, cuts off the blood flow to the brain, and you have less oxygen to the brain. Hence, you can have some debilitating changes, and you can have a lot of functions of the brain that can be stopped as a result of no blood or oxygen. So, what are the types of stroke? So, there's two types. There's ischemic and there's hemorrhagic. We'll discuss more in detail about each of them, but most of these strokes are usually ischemic, as in the lack of blood flow because of the blockage. And hemorrhagic is simply the factor that there's a blood vessel in the brain and it's bursted. So and then all these blood just goes inside the brain. So ischemic stroke blocks cerebral perfusion, and a lot of the reasons of the blocking are thrombus or embolus. And depending upon, like, let's say if you have atherosclerosis, large vessel disease, all these are factors that will eventually lead to an ischemic stroke. You can have an atherosclerosis in the neck, in the carotid arteries, or anywhere, and it can get cut off and go to the parts of the brain where it can actually end up causing a stroke. So that's that. And going on. So as you can see, this is just telling you more about what I just discussed. It's the fact that, if there's a clot formation occurring in any part of the body, let's say it cuts off, it becomes an embolus and can get stuck in a small vessel in the brain, and that can end up causing some really uh, destructive, not really destructive, but debilitating changes in the body, especially in terms of, like, some may lose their. We'll talk more about symptoms as we go along, so we'll have more idea of what's really going on. TIAs are also similar in a way, but they usually happen within 24. They basically retreat themselves. People are symptom free after 24 hours, within 24 hours. The reason behind these are the fact that, like I said, that some part of the atherosclerosis or thrombus can cut off and go to the small vessel of the brain, sometimes what happens is that that vessel gets cleaned out soon after, and so then the symptoms are gone. And that's what happens in a TIA. It is definitely a medical emergency, as people with a TIA are 9.5 times likely to have a stroke. And also another factor is that TIAs are one third of the patients that have TIAs are most likely will have a stroke, actually. So that's a pretty high number in that case. They are the warning strokes that can happen before major strokes, so this is why it is a medical emergency and needs to be checked out. So what causes a hemorrhagic stroke? Well, there are many risk factors related to hemorrhagic stroke. Weakened blood vessel ruptures, for example. Hypertension, which is when you have lots of blood going, stressed blood going through the vessels, it can cause a rupture in the brain. And another one is the aneurysm, ballooning of a blood vessel. Basically, it means that it is an outpouching occurring within the blood vessel um, that causes collection of blood in a certain area, and it can impinge on parts of the brain and push the brain to one side or the other depending on where the aneurysm is. This can lead to different symptoms based on the presentation, based on where the location is. And arteriovenous malformations is a cluster of abnormal blood vessels. Usually, people or a lot of the genetic conditions can lead to AV malformations. Still, a lot of people cannot. So a lot of people have symptoms at a different age in their lives if they do have AV malformations. So some of the signs and symptoms for stroke are severe headache, sudden confusion, trouble speaking, sudden dizziness, trouble seeing in one or both eyes, sudden numbness, weakness, especially on one side of the body. These are some of the most common symptoms that people always come up with. And some of the other ones that can occur, but not always out there, are altered level of consciousness. You have difficulty swallowing, pupils unequal in size, reaction to light, convulsions or seizures, loss of bladder and bowel control, nausea and vomiting. All these symptoms are, as you can see, are based on anything that brain controls. It can be affected. That's what it comes down to. For example, the way you move, you're moving your arm, that's part of your signal from the brain. So everything can be affected through a stroke, depending on where that stroke is. This just tells you more about what I just said, more or less. These are different parts of the brain that can affect different things that we do on a daily basis. Using leg, body, arm, hand, face, speech, reading, sight, hearing. And continuing more on what I was telling you before, all these different parts of the body can end up causing different symptoms. And so it makes it easier for the doctors to recognize where the stroke is really occurring most of the time. So some of the effects of stroke. So for example, if it's a left-sided brain injury, as we all know that, left side of the brain controls the right side and right side of the brain controls the left side. And so whenever you have a stroke on the left side, you're going to have paralyzed right side with speech language deficit, slow, cautious behavioral style, memory deficits. Left side of the brain has the speech and language, and that's why that's a huge factor whenever we have a left-sided brain injury. And then the rest is pretty much self-explanatory. Some of the right side of the brain causes is basically that, let's say, it's usually more spatial, perceptual deficits. You'll have quick, impulsive behavioral style as compared to the slow, cautious behavioral style. And then memory deficits is always there. So one of the most important factors to note in stroke is that time is money, aka the amount of time that you spend. Scratch that. So what I mean to say is time loss is brain loss, like it says over here. The fact that the moment you realize that this could be a possibly a stroke, it's best thing to do is to call 911 or go to the nearest hospital, because once once you pass a certain amount of time, and let's say if you do not get TPA, which is a like a thrombus blaster, clot buster is what they call it. Um, it makes it really difficult to recover from these um, from stroke, because a lot of times all of these changes will be permanent. You're not going to be able to get back the function that you usually had before. Maybe if even if you do, it may not be 100%. So this is something that I found online from NIH, which talks about the golden hour of evaluating and treating acute stroke. Dual to needle. Needle is when they put in a needle and they give you that TPA that I talked about, the clot buster. That's what the needle means. Ideally, let's say if you suspected a stroke, patient comes with the ED within excuse me, less than 10 minutes, you figure out that this person has a stroke. They'll go ahead and get a CT scan. We'll have a stroke team come in. Same time, CT scan gets done. All the lab results comes in, making sure all the glucose and making sure that they're not on any other medications that are, if they're on any blood thinners, then, TPA cannot be given at the same time. It could be too much, and he or she can end up dying from hemorrhage if it's an ischemic stroke. So you have to put all these variables together and try to evaluate the patient as fast as possible within less than 60 minutes to golden, which is called the golden hour. On a scan, you can differentiate these different kinds of hemorrhagic versus ischemic. As you can see in this picture, you have a wedge-shaped cortical infarct versus the intracranial hemorrhage will show blood is bright, so it shows up as hemorrhage. So it's really clear on the non-contrast CT to see if there's a hemorrhage or if it's an ischemic stroke. And it's the first, you cannot give a TPA without taking a non-contrast CT as a result, simply because if you are giving a clot buster and this person has a hemorrhage, this person is just going to end up dying and bleeding everywhere in the brain. That's why it's a precautionary measure. So how are the strokes treated? Acute treatment for these strokes, like I said, is IV TPA, which is they're just gonna quickly give you TPA and hopefully that will resolve all the symptoms. And some of the times, if the strokes are, if they're not cleared out, then they'll do endovascular procedures such as thrombectomy, which is mechanical thrombectomy, and an intra-arterial TPA. So what they'll do is they'll go ahead and take them to the neurointervention room, and they'll check where the clot is. They'll get a needle through a femoral line, which is inner groin area, and they'll try to take the clot out either, or they will try to throw in more clot busters in that specific area where the clot is, hoping that the clot will burst. TPA dissolves fibrin in blood clots. That's the whole function of TPA. And as you can see in this picture, this person has the right posterior cerebral artery occlusion. Doesn't matter. I'm not trying to bombard you with any of these names for the specific arteries. Just know that there's an artery that was blocked on the left side of this picture, and once they were given a TPA, you can see how the clot probably dissolved, and you were able to see those blood going through those parts of the blood vessels and parts of the brain as well. This is just showing you an endovascular perfusion, as I already mentioned before. So how are ischemic strokes treated? Preventative treatments usually include blood thinners, and so warfarin is one of them. There's also novel anticoagulants as well nowadays. Warfarin is less commonly used. Antiplatelet agents like aspirin, carotid endarterectomy is basically that they'll do a surgery here and try to take the clot out that way, and then or they will end up stenting the carotid by just placing by putting like a balloon or putting plastic doing a plasty or something like that. And there's the angioplasty right there as well. So that's the same thing. They'll just put like a stent sometimes to keep the vessel open more often. And there are many drug-eluting stents which will automatically, you know, it will release certain anticoagulants while they're inside that artery. That way, that way the body cannot reject them by creating more thrombus. And it does happen more often than so that the same place they'll get another clot, and so they'll have to go ahead and do it again. Risk factors is it's a major factor is definitely the controlling the risk factors like smoking, cholesterol, blood pressure, etc. How are hemorrhagic strokes treated? Well, surgery is a prime method. There's also endovascular procedures such as coiling is often used. Reversal of blood thinners. So this is where you got to slow down on the blood thinners or basically find a way to reverse them by giving them vitamin K or certain things that will there are platelet builders, and you try to search for the underlying cause of this bleed. So let's talk about these risk factors. How do you reduce your risk in prevent a stroke? Some of the major risk factors are high blood pressure, smoking or tobacco use, diabetes, carotid or other artery disease, AFib, and other heart disease. AFib in particular is oftentimes the case because a lot of the times during AFib, there's always be like a particular part of the heart wall where like it can just break off and just end up going to the brain. That's how they can end up causing a stroke. The whole reason of the physicians trying to figure out where the stroke is, because it makes it easier for the physicians to target what treatment they should be giving them in terms of whether this stroke is coming from like a clot from a leg like a DVT, or whether it's coming from a heart disease, or do they have family histories of stroke, or these other factors like tobacco, for example, high blood pressure. Did it is it a AVM? Like all these things matter. So this is why physicians keep these patients in the hospital in trying to help figure themselves out what's really going on behind the reason of the stroke. Other risk factors include sickle cell disease. During that time, people just require a lot of blood transfusions a lot of times. High blood cholesterol, poor diet, physical inactivity, and obesity. So some of the factors that can be treated, if I gotta mention, is the fact that like you can high blood cholesterol, poor diet, physical inactivity, and obesity that can be easily treated. Sickle cell disease, it's something that's genetic. The only way to make sure that it's been taken care of is the fact that you make you make the appointments, you go on these appointments with your doctor, making sure that everything is going right, and yeah. Some of the things you cannot treat at all are age, for example, something like family history, sex, prior stroke, TIA, or heart attack. Because they're nothing in your, this is not in your power to control. And so you can't really be, we can't really treat them. It just happens that, as you, like I showed you the factor before, that, as you, um, every decade of life increases the risk of a stroke, and it doubles every time. So how do you reduce your risk of stroke? Basically, don't do them, you know. Besides exercising, definitely exercise a lot. So other actions that will probably reduce the stroke risk could be, limiting your alcohol intake. Don't do drugs. Women who smoke or have a history of blood clots should not take OCPs, as they cause more blood clots. Um, look for signs of a sleep disorder breathing. Rehab is a major part of a patient's life in a stroke after they have a stroke, because that's where they're gonna get their all their functions back, or try to regain their functions after the stroke, after the brain has been hit by a shock of a stroke, for example. And so self-care, mobility, communication, cognitive skills, social skills, depending upon what the patient's deficits are, the rehab will try to help them get the proper therapy they need. And many programs, such as long-term nursing care facilities, these are for the dependent patients who cannot walk, who are completely disabled. Acute care and rehab are for patients that can recover possible outlooks at home through uh, at home. There's also many health agencies you can have, also outpatient facilities as well. One of the rehab specialists, we call them the physical, and we call them the PM1Rs. And so physicians, and particularly psychiatrists, rehab nurses, physical therapists, occupational and speech therapists, these are all important part of a patient who had a stroke. It does not stop at a neurology. There's also speech and language therapists and audiologists, psychologists, and psychiatrists, because all these stroke patients end up being in bed, or being unable to work. They end up getting a post-stroke depression, and so that's why psychiatrists and psychologists can be part of that bigger picture as well, and help them out. And that's all that I have for um, talking about stroke. I hope you have it. Hope you have any. If you have any questions, just let me know. And these are the sources that I use. It's all right.